Lindsay's therapist now explains what Lindsay was reporting about suicidal thoughts and when that began
You just have to answer
escalating.
out loud.
Yes.
Okay. And so what did she say about thought content?
So thought content, worry about her infant and that she had an addiction to Ativan.
And you said you also, in this assessment, assessed suicidal thoughts, correct?
Correct.
And so did you ask her anything more about those passive thoughts that you indicated she reported?
Yes, and what she reported as far as like passive thoughts were thoughts of not wanting to be here or no longer wanting to live, but no plan.
Dukes describes these as passive suicidal thoughts. The key distinction in her assessment was that Lindsay reported no plan.
And is that significant to you, the fact that she identified there was no plan?
Yes.
And why is it significant?
Because if she identified that she in fact had a plan, then that would escalate me to see it as a crisis and request higher level of support at that time.
As far as your observations of her thought process, were those within normal limits?
Yes.
And her intellectual functioning, were those within normal limits?
Yes.
Did she report to you any past attempts to harm herself or others?
No.
Did you go through with her her behavioral health history?
Yes.
And other than what you indicated as the anxiety and sleep, did she identify any concerns around substance abuse issues?
So she did identify concerns about, not in her history, but in that visit, about misuse of Ativan.
And if somebody expresses concern about that substance use, do you have a tool available to you to assess whether they have substance use issues?
Yes, so there is an assessment within the initial intake appointment that has a specific section to further assess substance use disorder.
Okay. And did you identify whether she presented with any substance use disorder issues?
I did assess that she did not present with any substance use disorder issues.
And as far as her expressed concern to you, fair to say it was focused on the one particular medication, the medication Ativan, correct?
Yes.
And why did you not find that to be an issue based on your assessment?
Based on my assessment and how she stated she was supposed to be using it, it was used correctly to remedy the anxiety symptoms.
Okay. And after this initial intake, I guess the first question is approximately how long is this initial intake appointment?
The initial intake appointment is typically an hour.
And after having spent the hour, gone through these assessments, spoken to her about her history, were you able to come up with or give an opinion about diagnosis?
Yes.
And based on her presentation to you, what was your opinion about diagnosis?
At the time, my opinion about her diagnosis was postpartum anxiety because she had a lot of anxiety about most things.
So after this hour-long intake, Duke's assessment was postpartum anxiety, with continued therapy and medication recommended.
And so what were your recommendations as far as a treatment plan for her?
My recommendations at that visit was outpatient therapy, continued medication, and weekly visits with me.
And why did you recommend outpatient therapy on top of therapy with you?
So outpatient therapy was kind of like a blanket therapy, but more so like intensive outpatient therapy, partial hospitalization therapy.
And was your role in offering her weekly sessions an attempt to kind of bridge services and make sure she was getting everything she needed, or something different?
To bridge services.
And so after that meeting with the recommendation for weekly visits, did you begin to schedule additional visits with her?
Yes.
And after that particular visit on December 12th, did you send her any particular information?
Yes.
And how do you do that? How do you send patients information if you're not able to give it to them?
I can send it through my chart messaging.
Okay. And on this particular day, after your meeting with her, you sent her some resources about cognitive behavioral therapy, did you not?
Yes.
Your next contact with her was December 5th. Why December 5th, if you had just met with her on the 2nd?
That may have been the soonest available appointment that week for her.
Okay. And it was shy of the 1 week, right? Mm-hmm. Was there anything in your meeting with her on the 2nd that made it necessary to have a shorter appointment?
No.
This next contact on the 5th, was that in person or telehealth?
Telehealth.
And on this day, on the 5th, when you met with her, did she report some additional information or report how things had gone over the weekend to you?
May I see my notes?
Sure. If it's okay, I'm just going to give her all the pages from that note.
That's fine.
Thank you. Yep.
Thank you.
Okay. I'm just reviewing the note.
Sure. Take your time.
And can you repeat the question?
Sure. In that visit on December 5th, did she indicate to you or did she report to you how the weekend went for her?
Yes, she did.
And what did she say about the weekend?
She reported that over the weekend she had a difficult weekend, having intrusive thoughts about wanting to die, and that she had contacted Aspire Crisis Support. She met with the clinician virtually and was told that she did not meet the criteria for inpatient treatment due to having no SI plan, suicidal ideation plan.
But over that weekend, Lindsay reported continuous thoughts of wanting to die and contacted Aspire Crisis Support. She says Lindsay was not admitted because she reported no plan.
She reported the intrusive thoughts and having a tough weekend. Did you follow up with her and begin to kind of talk with her about that?
Yes.
And what did she tell you about what she was feeling in those intrusive thoughts?
So in those times, what she reported was that it was continuous intrusive thoughts of not wanting to be there, but no plan.
Okay.
So kind of like the same report that she gave to Crisis.
Okay. And as far as kind of the difficulty of the weekend and how she was feeling, did she tell you how she was feeling?
No.
In that particular meeting, when she had talked about wanting to die or not wanting to be there anymore, did you kind of follow up with her about those statements and whether she had any sort of intent or plan?
Yes.
And did you ask her additional information and complete that full mental status exam?
Yes.
On that meeting? And were there any signs of psychosis or signs of mania or homicidal ideation?
No.
And at the time that you met with her on the 5th, was she currently having those thoughts about wanting to die? If you know?
Just reviewing the note.
Sure.
In that visit, she had no suicidal ideation.
And on this particular visit on the 5th via telehealth, did somebody else participate in the visit as well? I could direct you to page 45.
45?
Yeah.
Okay. Yes, her husband joined the visit.
And this visit, approximately how long was it, if you recall?
This visit was approximately 30 minutes.
And fair to say, focus of the visit was to kind of deal with that bad weekend and calling
Yes.
the crisis center.
Yes.
So what did you offer her as far as recommendations or assessments or assistance during this meeting?
So support during this meeting, I offered her support in connecting to, it seemed like she needed a higher level of care, so intensive outpatient therapy, partial hospitalization therapy.
By December 5th, Duke says Lindsay needed more support and began recommending intensive outpatient or partial hospitalization treatment.